Assalamualaikum warahmatullahi wabarakatuh. Good day to everyone. I hope you are all in good health. Today I will be speaking on a topic that is almost mostly known as plastic surgery in Indonesia, but I would still like to add some more points on this topic. It's about honey dressings, what we know and what we've learned in the years of using it as a wound dressing. So I will guide you through an outline of what my presentation will cover. First, we will cover about the history of honey as wound dressing, and then how it works, what types of honey dressings available, our research currently and past research, and a bit of a sample case of honey application. The history as a wound dressing. So it goes way back. The usage of honey has been reported on 2100 to 2000 BC from a Sumerian tablet writing that mentioned about honey using as a drug or as an ointment. Even Aristotle and Hippocrates are one of the few famous figures that mention about honey and its usage as good for wound healing or good for health. So for an ideal dressing or combination of dressing is considered to be one that ensures optimal healing by several points such as in this picture. So honey covers almost all of these points. But how does it work? So we need to know the physical and chemical properties of honey and which of those are responsible for its role in wound healing. The antimicrobial effect. Topical antimicrobial agents currently used usually has iodine or sulfur in it or antiseptic agents. But honey is also considered as antimicrobial. It acts as a debriding agent and can help with odor control, which is a plus. The other properties known for honey are antioxidant, antibacterial, anti-inflammatory properties. The wound dressing would promote rapid and improve healing. The antibacterial action is actually due to the high acidity of the honey, osmotic effect, antioxidant content, and also hydrogen peroxide content. The types of honey dressing available, also in Indonesia in particular, we're going to cover about this. Things to remember though, although honey has a broad spectrum of antibacterial activity, but there is much variation in potency between different honeys. And we can see the two on the left side, the Manuka honey UMF10 and also Nusantara honey. Both are also pure honey. The Manuka honey is actually honey that are mostly used in international publication for wound healing. The local honey that we have researched are the Madu Nusantara Murni. But both of these are not medical grade honey. Medical grade honey are considered in the two on the right side. We have the Medi honey. Medi honey is medical grade honey and it contains like a paste or a cream on the bottom left, bottom right on my slide. And sometimes they also combines it with calcium alginate or wound dressing. And we also have the medical grade Manuka honey that are still in the liquid form. And our previous researches, we compared the Indonesian local honey with Manuka honey. Sundara et al. And Dia et al. Compared it. One compared the physical chemical characteristic and the other compared the antibacterial activity. And both researchers show that Indonesian honey is comparable to Manuka honey. But we have to know there are limitations on this research because it is done a few years back. The Manuka honey that are available at the time in Indonesia or in Jakarta in particular was the MGO14. It is comparable to the UMF13. We do not have the UMF5, 10, 15, or 20 at the time. So our current researchers wanted to add more to that previous research. We tried to find the characteristic of Indonesian local honey compared to the Manuka honey from the physical chemical component, unique medical factor, and antibacterial effect. We compared these two groups of honey. And then in the local honey or Indonesian honey, we compared the Nusantara and Java honey. And then for the Manuka honey, we compared the UMF5, UMF10, and UMF15. We did 3 kinds of tests, which is the physical chemical characteristic, the unique medical factor, and the minimal inhibitory concentration against bacteria. The results. In the physical chemical properties are seen in this table. Generally, the Manuka honey has lower pH, higher viscosity, and higher sugar content. And the unique medical factor comparison, the UMF actually stands for the methyl glyoxal MgO content and also the non-peroxide activity of the honey that is being tested. And we tested the local honey also. We found surprisingly that Nusantara honey and Java honey also contain this unique Manuka factor, although significantly lower from the Manuka honey and Java honey. But the Nusantara honey still has a methyl MgO and also NPA content. We compared the local honey and the Manuka honey also in the antibacterial activity, and we tested towards these 5 bacteria. We can see that the Manuka honey generally has lower concentration to do the inhibitory effect towards these bacteria. So the result, in summary, the New Zealand Manuka honey has lower pH, higher acidity, higher viscosity, and higher sugar content compared to Indonesian local honey. And it has higher MgO content and NPA. But it also has higher antibacterial activity only to Pseudomonas aeruginosa, Klebsiella pneumoniae, and Staphylococcus aureus compared with the Indonesian local honey. But the Nusantara honey shows comparable effect with New Zealand Manuka honey UMF5 in antimicrobial activity in several bacteria. And then we move on to the next research. We did a research to see the effect of local honey as topical treatment and chronic wound healing and experimental animal study. We did it with an animal study using 36 rats, practically strain, wounded until the muscle. And then we injected with a Pseudomonas sp, and it became a chronic wound, which we treated with 3 kinds of treatment: Manuka honey, Madu murni, and Java honey. The macroscopic evaluation was observed on day 0, 3, 5, 7, 10, and 13. And on day 5 and 13, we did euthanize the rats to do the pathologic examination. The observed parameter in clinical examination were the wound area, presentation of necrotic tissue, slough, and granulation. And it then evaluate with the image application. This is the clinical pictures of the wound on day 0, 3, 5, 7, 10, and 13. We can see that significantly, we can see a decrease of wound size on all groups, and especially from day 0 to day 3. And eventually the wound healed. The statistical result shows that only on the day 3 compared to the day 0 has a statistically significant effect. So in the short term, the Manuka honey has the most wound size reduction compared to the other 2 honey. But we did a post-hoc analysis and found the significant differences is between group Manuka honey and Madu Nusantara, and then Madu Murni Nusantara and Java honey. But when we're comparing the Manuka honey and Madu Murni Nusantara, there are no significant differences. And it proves again that Madu Murni Nusantara and Manuka honey has similar characteristics to promote wound healing. Again, I need to remind that when using honey, different honeys, well, we would need different kind of application for it to work as a wound dressing. This is how we use a Nusantara Murni honey. So we dip a gauze in Nusantara Murni honey, and then until the gauze is soaked completely with the honey, and then we could apply it immediately to the wound. But when we're using Manuka honey, since it's significantly the texture is different, it's not so liquidy, the viscosity is higher, it's almost like a cream or paste, we could immediately just apply it onto the wound and then cover it with a secondary dressing such as a dry gauze. This is our sample cases where I've used Manuka honey UMF10. In just less than 2 months, the picture is significantly different. The wound is getting better. The granulation tissue is formed. And also in this picture, aside from the granulation tissue and the debriding effect, the rapid epithelialization is shown in the distal part. I did not do a skin graft on the distal part. I only did a skin graft on the ankle joints. And the plantar side also healed nicely secondarily, only using the Manuka honey, also seen in this picture. So in summary, honey can be used in acute and chronic wounds. It promotes rapid epithelialization, wound contraction, and decrease the pain, ensured infection control, and shorten the time of wound healing. And last but not least, it is cost effective. This is some works that I cited. And thank you for the time given for my presentation. I would welcome any question to my email, melati@gmail.com. And I would also to express my apology for not being able to be present during the question session. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.